Hello, everyone, and welcome to the fitness week of our 50 Days DNA Health and Wellness Challenge. Today we have with us Daniel Dent. Welcome. Daniel Dent is a certified personal trainer, corrective exercise specialist, and integrative health practitioner specializing in industrial ergonomics and diabetes health. He helps clients improve movement, reduce injury risk, and manage chronic conditions through a practical whole person approach to fitness and wellness. So thank you for being here with us, Daniel.
Hey, thank you for having me, man.
Course. So today we're going to be talking about using movement to support metabolism, heart health, and disease prevention. Is that correct?
That's correct.
All right. So why don't you go ahead and set the context for everyone, and try to talk about what does longevity really mean beyond just living longer? Because obviously, when you hear about longevity, you're like, "Oh, I want to live a long life. I want to, live till I'm 80, 90 years old." But what does it mean in the context of movement?
So longevity, we especially when we think about it in a health and wellness mindset, we think of the quality of life instead of just the quantity of life. So you can live a long life, but if you having so many health issues throughout that life, I mean, you really don't enjoy that type of life. So we'll say, the health span instead of the lifespan of a person.
Okay. That makes sense. It's really you don't want to just live long if you made it to your 80s and 90s, but you're unhealthy, you need someone to take care of you all the time. So it's about
Right.
I guess it's about the quality is what you're saying, is what I'm getting from it.
Yeah,
Um,
that's correct.
okay, so why, in your opinion, is movement one of the most powerful and probably underrated tools for disease prevention?
Well, I like to say movement is medicine. It's it's definitely medicine for the body. When we think about just, how, just getting your blood flowing, how that affects your organs, your energy levels, your longevity, how your hormones pretty much work in the body. It can be medicine for the body when you kind of get past the fitness mindset of it and think of like how it benefits you, overall.
Okay. I can see that. And so when you talk about movement as medicine, um, are you talking about like energy and like having better energy levels, or is it like something about the blood sugar? Since those things and heart health, those things obviously affect the African American and African community kind of disproportionately. So when you say movement is medicine, do you want to speak about maybe a little bit of the specifics of that?
Yeah, I mean, when you think about like, I'll say this: when one area of your health goes away, it becomes like almost your main focus in life. Almost, it's like if you got a headache, you're not worrying about nothing else but that headache. So for some people, it can be heart health. For some people, it can be diabetes. Other people, it could be just any other conditions that's hindering them. So when you think about movement as your medicine, you're going after a root cause that really can just alleviate some of those conditions, and that can become medicine for that person.
Yeah, I can definitely relate. When we see things in front of us, that is our whole focus, and you know, trying to find something like movement, just being more active to trying to, not only the immediate thing you're focusing on, but your general health. That's always a positive. So if I kind of want to get more clarification on the specifics. So if we could talk about movement and metabolism. So how does regular movement improve insulin sensitivity and blood sugar control? And what is insulin sensitivity? And how does that relate to movement?
Yeah, so when you think about how your body uses energy, we when it comes down to like blood sugar, if you intaking anything that has some type of sugar content in it, your body naturally want to use that towards energy. So what happens when people are insulin resistant? their body has a hard time of sensing the glucose or that sugar that enter into that bloodstream. So when that happens, usually that's when people have higher blood sugar levels, and they have a hard time of getting it back regulated. We would say homeostasis, that's pretty much like the balance of blood sugar. And usually when people have like insulin resistance, their blood sugar is elevated for a longer period of time. But if you are more insulin, let's say sensitive, your body works. You pretty much the insulin will use that sugar and put into the cells to give you energy, and it just pretty much how your hormones like interact with each other, interact with your brain to allow your body to operate the way it's supposed to. So I know I said a mouthful, but the main takeaway is how your body uses sugar.
Okay. And so, in your opinion, what type of exercise are most effective for metabolic health and improving that insulin, or I guess combating that insulin sensitivity and trying kind of regulating your blood sugar?
I will say there's no exercise over another. All of them has its own benefit. So when you think about aerobic, which is cardio based type of training where you got to use a lot of oxygen to get through this type of training. So it can be running, it can be jump rope, it can be, sprints. It can be those type of movements that requires you to use more oxygen. Then you have your anaerobic type of movements, which can be like your resistance training. So that's like pushing weight, moving things, that pull, that push type of movement. Our body needs both of them because we need muscles to, help, with movement, also with just doing certain things, whether it's picking up something from the ground, pushing something away from you, pulling yourself up if you fall off the ground. But also we need oxygen too, walking up a flight of stairs. You won't be surprised like or you probably will be surprised that a lot of people have a hard time of just walking up and down the stairs without that like really almost taking them out. So, when we just talk about like metabolic health, we need all forms of training to answer your question.
Okay, so try to get a little bit of everything is what I'm hearing.
Yep,
Um,
correct.
so you talked about getting the oxygen going and you talked about just, getting the blood flowing. So I want to kind of talk about heart health. I think it's especially relevant to the community we're targeting with this health and wellness challenge. And
Yeah.
so I kind of want to try to connect exercise to heart health, and kind of make it a little bit more manageable for people. Some people, they hear the messages that come out, and it's a little bit scary. It can be a little bit scary. It can be a little bit hard to digest. So, um, I guess simply speaking, how does movement improve heart function and circulation, blood circulation?
Okay. Yeah. So when we look at the heart, we got external muscles, which the muscles that we see on the outside of our bodies. But when you think about the heart, the heart is another muscle, is an internal type of muscle. And when it comes down to like movement and heart health, you know, we got to condition our heart to be able to pump blood efficiently. When we don't move our bodies, our heart has a hard time of dealing with like stressors. So when we have like a fight or flight situation, which causes our heart to pump harder, it's hard for us to kind of correlate, okay, breathe, breathe through this situation. You need oxygen, So when you start exercising and training your body, you also train your heart to be able to pump blood, but also your it's like you kind of get your mind involved, like, okay, you need oxygen as well. And it's almost kind of like you training your heart to be able to pump this blood more efficiently. And this helps with like circulation of blood flow throughout the body. A lot of people have a hard time of I wouldn't say a hard time, but I would say when the blood is pumping too hard, too fast, just throughout the daytime, they have a hard time allowing their body to relax. So when you start to exercise, you train your body to be able to handle that blood circulation or that higher blood pressure.
Okay, and you mentioned blood pressure. Could you speak a little bit more about blood pressure and cholesterol, and how does exercise combat high blood sugar or high blood pressure and bad cholesterol?
Yeah, so I know it seemed like a lot of these different systems, like they work, um, like they have their own type of function, but they all work together. So earlier, I explained like how blood sugar, is used in the body. So when you're not active, this sugar that we intake over time, this becomes like adipose tissues, which is fat within the body. So most of the times when people have like heart conditions, it's because they have a hard time with their blood being able to circulate throughout the body due to this adipose tissue blocking the way for this blood to get to the heart. So when it comes down to like exercising, you just help burn this extra energy of this fat that's within our body. So our blood stream, well, I'll say our blood veins have like efficient blood pumps that don't have any type of resistance. So I know it can be confusing, but the more you start to exercise, the more efficient your blood flow becomes.
Okay, so the heart is a muscle, just train it. So I know
Yeah.
you spoke a little bit on the metabolism side about different types, a little bit of every type of movement to boost your metabolism. Is there a specific type of exercise for heart health that you recommend, or is it kind of the same, get a little bit of every different type of movement?
Yeah, I would say get every type of movement, whether it's resistance training or cardio based training. Now, for heart health, um, the cardio based training is more ideal because this helps you to control your breathing. One of the main cues when I personal train somebody is not just the technique and the form, is reminding them you got to breathe. A lot of people don't breathe when they push or pull. They get into that fight or flight where they holding their breath and they the whole time they just holding their breath. I'm like, breathe. You got to breathe. So when you start doing like cardio based training, you teaching yourself to intake oxygen.
Okay. And you speak on these things and it sounds so simple, and thank you for making it sound simple. But it's like you don't even think about these things are just like the basic, you know, things for living, breathing, heart circulation, movement. But sometimes it gets, confused or, big words and stuff, and people start to lose sight of it's just basic stuff that you're trying to do to take care of your body. And I guess part of taking care of your body goes into aging healthily. You spoke in the beginning about longevity not being just how long we live, but that quality of life. And so I guess kind of want to shift the focus towards aging and healthy aging. Um, I know people always talk about exercise and they talk about, going to the gym and putting on muscle. That's a big thing in our culture these days. So I wanted to know why muscle mass is important as we age.
Yeah, so as you get older, some of those things that you was doing when you was younger get a little bit harder. Um, Certain movements, you find yourself trying to pop your back more. You stretching your body a little bit more because now that flexibility started to dwindle down. So when it comes to like having like muscle mass on your body, you have a layer of protection on your body. If you just skin and bones, really, when you have a fall or something like that, it impacts that body a little bit more than somebody who's who has a layer or armor on their body. So when you start to like do some type of resistance training, it's like you condition or you training your body to take impact or be able to take impact a little bit better. As we get older, we naturally lose muscle mass, but if you can, especially in your younger days, if you can really try to um, have a more muscle mass compared to fat ratio, you just it comes off a little slower than somebody who don't do any type of movement at all. So it's very important to have some type of muscle mass to do your daily activities.
Now, when you say muscle mass, are you saying everyone has to walk around like, Superman, or is it just, having a little bit of hefty to them?
Yeah, I think a lot of people they when they think of like going into the fitness room, they think the first thing they think of that they're gonna look like like a superhero. And a lot of ladies they don't want that look. A lot of guys they like that look, but you got to train yourself to get to that point. You got to eat a certain way to get to that point. So you're not gonna be looking like a superhero. You're just gonna look more. I would say your physique or your body becomes a little bit more defined, and you yeah, that's the way I kind of put it. You become more defined in your body.
Okay, so what I'm hearing is, for one, it's not going to happen overnight anyway, and two,
Right.
it's just going to be a healthier look. You don't have to go all out and looking like Superman and be super super buff. So I want to continue talking about the role that strength training plays in aging in a healthy way. You
Mhm.
mentioned falls and having that armor as a way of combating falls, but what role does training and exercise in general play with like balance? Because part of the fall risk with some older individuals is they lose some of that balance. So I was wondering, what do you think that strength training and mobility plays in that realm?
Yeah, a lot of people when as we start to age, we lose coordination. And when it comes down to strength training, being in an environment where the exercise is more structured, depending on the type of exercise you do, it helps out with your coordination, your eye to your, where you're stepping at, where you pivoting your feet. If you don't train or you don't do any type of strength training or functional training, your body it pretty much reacts to things a little bit slower. Um, for athletes, we would say we got a fast twitch muscle where we will, you know, where we look, we pretty much we step to it pretty quick. But as you start to get older, it's like your mind and your muscle, the connection slows down, and it's like your head is turned this way, but your body is turned this way. A lot of people lose that coordination over time, but with training, it helps you to kind of stay focused on that muscle mind connection.
Okay. Do you have any specific exercises or type of exercises to kind of hone in on that functional mobility?
Yeah, so it can be something that uses the whole body at one time. So whether you want to squat to press at the same time, you teaching your body to be able to use the whole body instead of just use one muscle group. Because when we do like daily activities at home, most of the time it's not just one muscle group like you see like a gym equipment that only focuses on like a bicep muscle. This is focusing on your core, your breathing, your coordination. So if I can think of like just I said squat to press. It can be like shuffle walks, being able to shuffle your feet, being able to pick up your knees when you do like your shuffle walk. Because a lot of people, as we start to get older, we start to lose that being able to bring our feet up. We start dragging our feet over time, and a lot of people fall from the dragging of feet. So being able to use those hip muscles to pick up that leg while you walking, right now, I mean, as you for a younger person, they don't have to think about it. But for an older person, they probably have to think about, okay, I need to pick up my leg. I need to pick up my leg so I don't fall. So, when you train yourself to do certain things, you just you're well suited, you better prepared.
Okay. So being deliberate in your training is what I'm hearing, and focusing on those full body movements. Okay. That makes sense. I want to go back to what you said in the beginning as movement as medicine. So I was wondering, can exercise offset some of those genetic risks that we often carry? Many of us often carry, it runs in our family, or certain things run in our family. So I was just wondering how you felt about that.
Yeah, so when we talk about like some of the main conditions, especially our community, other communities are faced with, we think about heart disease, we think about diabetes, we think about cholesterol, high blood pressure. Those are some of the most common things. And also, things like joint pain. A lot of people, as they start to get older, even younger guys too, we deal with like some joint pain, whether it's our shoulder, our knee. So when you think about movement as medicine, you're not only tapping into your muscles, just the outside of your body. You tapping into how your hormones function. You tapping into how your blood is circulating throughout your body, how your body is using sugar to rebalance itself. So this is a medicine that is free. It's a medicine that's free. Movement is free. But when you're forced to take a medicine that you don't want to take and it costs you money, that's an option that I will try to avoid all day, every day. But movement, I mean, you really alleviating a lot of those conditions that we see in our community all the time.
Okay, so one thing that perked my interest just now when you said it's free medicine, you don't want that medicine you have to pay for. So I you
Man,
know
yeah, the price of living now, man, those medications, they can be very expensive. And, as you get older too, a lot of people lose like health insurance. They're not able to work. So that medication is higher. That is sky high. So might as well do something that's not gonna cost you no money, and it's just gonna benefit you, in so many other areas too.
Yeah, I think that's going to be one of the big takeaways that I think a lot of our listeners and viewers will take away from this. They're like, wait a minute, he has a point. Medicine.
Oh yeah.
When you talk about movement and you talk about exercise, I know you've been talking about the different types of exercise. Is there a difference between like living an active lifestyle and exercising?
Active lifestyle so when you think about exercising, most people think about just the gym setting. And that gym setting can sometimes be like a structured type of plan. So it's like, okay, today I'm working on upper body, core. Tomorrow I'm gonna do lower body and core. It's more structured and more organized. So when you think about like just being active, it can be like just walking, it can be gardening, it can be fishing, it can be things that you like to do that actually, sometimes it can get your heart rate up. Sometimes it keeps your heart rate down, but you still move it, you still working your muscles to walk to certain areas. So it's more of a relaxed. I'll say being active can be a more relaxed type of activity compared to the exercise where you actually put yourself in a fight or flight situation. But it gets better with time. So both of them is beneficial. So I recommend both of them.
Okay, okay, that sounds good. So I might skip the gym and just go fishing. I'm just joking, but
Man, if you fishing in the area where you gotta walk to like a certain, like a longer location, and especially if you walking around and trying to hit different spots, fishing it can definitely take a toll on you, you know. But also it works another muscle, or it works another area in our body, which is our brain, our patience.
Yeah.
So you know,
Oh yeah. We could all use some more patience, that's for sure.
yes, sir.
Um, so I want to kind of wrap this up and bring everything full circle. So I kind of want to talk about the barriers that people face when starting or maintaining exercise. What do you see as the biggest hurdles that people face and obstacles?
I think a lot of people they are not real with themselves. So when they think about exercising, they think about getting in shape. They set these high level goals. Like they'll set a goal that they know they probably won't be able to do, but it sound good, it look good. You know, you see the outcome in your head, but going through that process can can um can hinder some people. So some people they'll start off on a fitness journey, like, okay, I want to start working out 4 days out the week, 3 or 4 days out the week. But you haven't worked out one day in the whole year. So I think most people they need to set like more realistic, small, attainable type of goal. We'll say that's a SMART goal, something specific, measurable, attainable, realistic, and also time based. So we'll say that's a attainable type of goal. So set a goal like, okay, I want to work out one day out the week for the next few months or something like that. If you break it down for a whole year, you got 4 different seasons. Every 3 months, add an extra day. So for the first 3 months, let's do one day out the week. For the next 3 months, let's do 2 days. Next one, 3 days. And then when you get to the last 3 months out the whole year, you up to 4 days of training. And if you look back, it's like, okay, that's more of a gradual, realistic type of habit I can set for myself. So I think being real with yourself is a barrier for most people.
Okay, so just being realistic and setting realistic goals and really taking time. I know personally when I talk to friends or coworkers or what have you, and even for myself, I think one of the biggest things is, getting discouraged when you go in and you have a good week, you go in every day, but then your muscles are sore and they're sore for a whole week, or now you're tired and you're like, well, and then next thing you know, you haven't gone back to the gym and it's been a month. So
Oh yeah, yeah,
I think that taking those small, bit at a time and being realistic about what you can and can't do, I think that's something that everyone should focus on.
yeah.
So if someone could focus on just one thing for longevity, what should it be?
Focusing on one thing for longevity. I go back to that movement in medicine. It's if you just do something every day, just do something, get that body movement. That's just gonna help out with we talked about different areas of like health and wellness, whether it's or I would say like health conditions. Just moving the body will be beneficial for you, especially if you want to age gracefully instead of, waiting till you're older to start trying to fix all these issues that come throughout life. Hit it head on. Go ahead and set that foundation. So once you start to get older, it's like your body is a little bit more prepared when these issues do come in place.
Okay, so I think that's all I have for you. If do you have anything as a takeaway for our listeners and our viewers? If you could just have one hammer, one point home that, if they didn't hear anything else, what would it be? What would your message be?
I think my message will go back to that portion when I was talking about, you either You either pay for your medicine, which is a medicine that you probably don't desire, and it costs you money, versus moving the body, which is medicine for the body. That's free. That's free and is more beneficial with no side effects.
All right. Yes, I know that's definitely a takeaway I have from this whole thing. Everybody get your free medicine, save some money.
You don't have to worry about a long commercial in the future telling you that if you exercise too much you might be dealing with nausea, bit nausea, things like that. This is something that is side effect free, and it's just something that passed down to your kids, because they're going to see you moving your body, and it's just going to promote them to become more active.
Okay, keeping it in the family. I see for the younger generations, setting them up right for success.
That's correct, man. But that's all I got, man. That's that. I'll say I'll leave with that right there.
Okay, well, thank you again for being here and being a part of this 50 days health and wellness challenge. Daniel did, everyone. Thanks again.
All right, man. It's a pleasure.
All right.